Hello students, this is Dr. Ways and welcome to your lecture on the leg. So when we're talking about the leg, specifically what we are referring to is that portion that's between the knee and the ankle, otherwise known as our lower leg. And just like we did with the thigh, we're going to divide the lower leg into different compartments. And so in this picture here, you see the anterior compartment of the leg, the lateral compartment of the leg, as well as the posterior compartment of the leg. And then here's your tibia and your fibula. All right, so this would be the medial aspect and the lateral aspect of the leg. We're going to start with the posterior leg compartment, looking first at the superficial muscles. So if we look at this lateral view of the leg right here, what we notice is we have two major muscles. One is the gastrocnemius, which is our primary calf muscle and the one you think of when you see the back of a person's leg. And then just deep to that, you have the soleus muscle. And the soleus is also another calf muscle, but since it's deep, you're not really going to see much of that. Gastrocnemius is more of a power muscle, whereas the soleus is more of an endurance muscle. And then the final superficial muscle that we're going to see is right here, called the Plantaris muscle, and we'll see that it's a really small muscle right here behind the gastrocnemius and soleus, but its tendon is rather long. And so we'll see what that does and how it plays into the functioning of the leg in the next couple slides. So first, the gastrocnemius, you see it's attached to the condyles of the femur, and then it goes down and it's attached to the calcaneus of the foot. So when it contracts, what it's going to do is pull that calcaneus up and your toes are going to go down. So what we call that is plantar flexion. So standing on your tippy toes would be plantar flexion. And its nerve supply is the tibial nerve, like we've discussed in previous lectures, where the tibial nerve separates from the sciatic nerve. All right, the soleus then is going to be right underneath the gastrocnemius. So you see this muscle here, and you can see it on either side of the tendon, the Achilles tendon or the calcaneal tendon, going down here to the calcaneus. It's also, insertion is also the calcaneus, and it's going to have the same function, plantar flexion of the foot at the ankle joint and supplied by the tibial nerve. Then the last muscle is that plantaris muscle right here. And notice that it is, its origin is again on the femur at the lateral supracondylar region. All right, so the upper condyle. Insertion is the calcaneus, so this little tendon goes all the way down to the calcaneus. So what its job is weak plantar flexion of the foot. So it's more of an accessory muscle to plantar flexion rather than one of the main drivers of plantar flexion. And in some people, the plantaris may actually be absent. So kind of highlighting, how weak the effect is on plantar flexion. Okay, so we've taken the plantaris out, we've taken the gastrocnemius out, and we've taken the soleus out, and we still have this group of muscles that are deep to those ones we've taken out, and so those are considered the posterior leg compartment deep muscles. So we'll start at the most superior and then work our way down, and so that takes us to the popliteus. So the popliteus, so its origin is in the femur. Insertion, notice that it wraps around the tibia. So it goes to the medial side of the tibia. And so when that muscle contracts, what it's going to do is medial rotation. So it's going to rotate the leg medially. And since your knee joint physically does not rotate that much, this small muscle only has a minor effect in its job. So you can also think of it as a stabilization muscle as well. It is innervated by the tibial nerve. All right, Below that, we have the Tibialis Posterior. So it's this triangular shaped muscle right here, and notice that the tendon is going down. So its origin, all right, we've moved off of the femur now, and now we're into the tibia and fibula. And its insertion is into the tarsals and metatarsals. And notice that those are on the plantar side of the foot, kind of in the middle here. And so what its job is to do is to help with plantar flexion of the foot at the ankle, just like we had with the Gastrocnemius, just like we had with the soleus and the Plantaris. But since you do have some insertions medially, like this medial cuneiform right here, it's also going to be involved in inversion of the foot, so rotating your foot inward, so the sole is pointing medially. So this slide's a little bit messed up here, but we're still in a deep compartment of the leg. I'm sorry, the posterior compartment, deep muscles of the leg. And next we'll go to our Flexor Digitorum Longus. So muscles are named according to where they're located, what they're attached to, or what their function is. And so this one in particular is, you see its function is a flexor, right? So anytime you see that, you know it's going to be involved in flexion. Digitorum, so that tells us it's going to go to the digits of our feet. And longus, because it's a long muscle. So if we look at it, here is our Flexor Digitorum Longus right here. And notice it's this long muscle that goes all the way down and then spreads out. Okay, so it starts in the tibia and spreads out to toes 2 through 5. So 2, 3, 4, 5. So its function, when it contracts, moves this way, is going to pull. So the insertion is here at the base of the distal phalanx, right? So distal phalanx. So it's going to basically curl your toes inward, all right? So curl your toes down as if you were trying to grab the floor. And as you would expect, the tibial nerve is supplies innervation. And then we have our Flexor Hallucis Longus. So our flexor, again, it's going to flex. Hallucis refers to our great toe or a big toe. And longus, again, because it's a long muscle. So here it is. Notice it's attached to the fibula. The posterior part of the fibula goes down and then goes to the base of the distal phalanx of the toe number 1, or our hallucis. All right, so when that contracts, it's going to flex that big toe as if, again, grabbing the floor, and it is supplied by the tibial nerve. All right, we've already seen this, the nerves in the posterior compartment of the leg. Remember, the sciatic nerve splits into our tibial nerve and our common fibular nerve. The tibial nerve is going to supply all of the posterior compartment muscles of the leg with its branches. We're not going to get into what the branches are, but if you recognize that the tibial nerve supplies all of the posterior compartments of the leg, that will get you where you need. So the arterial supply to the posterior compartment of the leg comes from the popliteal artery, and notice it extending down here till it gets past the popliteal region, and then it splits off into the anterior tibial artery and the posterior tibial artery. And the posterior tibial artery then splits off to form the fibular artery. So specifically the muscles that we've talked about in the posterior compartment to this point, the anterior tibial artery will supply the anterior compartment as well as the dorsum of the foot. And then the posterior tibial artery will supply most of the muscles in the posterior compartment of the leg and the plantar region of the foot, as well as the fibular artery will supply some of the muscles in the posterior compartment as well as some of the muscles in the lateral compartment. Now we're going to move on to our lateral leg compartment muscles, and so you notice here that we have two muscles, the Fibularis Longus and the Fibularis Brevis, both referring to their length. And since this picture is not on the next slide, I want you to notice that the Fibularis Longus tendon goes all the way here to the medial aspect of the foot. So when the muscle pulls on that, you can guess what the action is going to be, and we'll see that on the next slide. Another name for the fibularis, an older name, is the Peroneus. So often you'll see fibularis and Peroneus used interchangeably. They're both referring to the same part of the leg, which is a lateral aspect, referring to the fibula. All right, so the Fibularis Longus, of course, would be that longer muscle. Its origin would be the head of the fibula. And then its insertion, as we saw in the previous slide, goes all the way to the medial aspect of the foot, medial cuneiform, as well as the base of the first metatarsal. So when that muscle contracts, your foot is going to move outwards or rotate outwards, which we call eversion. That would be eversion of the foot. All right, and its innervation is the superficial fibular nerve. Then the Fibularis brevis, its origins the lower half of the fibula, lower portion of the fibula. Then its insertion is the base of the fifth metatarsal. So when it pulls, it's also going to result in eversion of the foot from a different angle. And again, this is supplied by the superficial fibular nerve as well. The nerves on the lateral compartment of the leg come from as we saw, the superficial fibular nerve, which is a branch of the common fibular nerve. So this is specifically going to go to the posterior compartment. And you see the deep fibular nerve coming here, and that will go to anterior compartment muscles. The anterior compartment muscles are next, and there are 4 of them: the Tibialis anterior, Extensor Digitorum longus, which we can abbreviate as EDL, the Fibularis Terseus, and the Extensor Hallucis longus. All right, so starting with the Tibialis anterior, notice its origin is on the tibia, and its insertion is the base of the first metatarsal and the medial cuneiform, so on the medial aspect of the foot. And so the anterior part of it is going to, when its muscle flexes, is going to point your foot upwards towards your face, which we term dorsiflexion. And since it wraps around the side, it's also going to cause your foot to turn inward, which we termed inversion, and we saw that with some muscles previously in the posterior compartment of the leg. All right, let me erase some of this. The next muscle is the Extensor Hallucis longus, which its origin is the medial anterior fibula, so it's going to be more over here to the lateral side, actually on the fibula, to the base of the distal phalanx of the first toe, so right here. So if we follow that up, that's where the muscle is. And so notice that's more of a deep muscle compared to the other ones that we are going to be talking about. And when that muscle contracts, it's going to pull the toe upwards. So that's going to be what we call extension of toe 1. All right, and it also take part in some dorsiflexion of the foot as well. All of the anterior compartment muscles are innervated by the deep fibular nerve, so that takes some of the memorization out of this, since all 4 muscles we're covering are going to be innervated by that same nerve. All right, the Extensor Digitorum longus, or EDL, is this long muscle right here that goes down and attached to the tibia as well as the fibula, and then it goes to toes 2 through 5 on the dorsal surface. All right, so when that muscle contracts, what it's going to do is it's going to extend those 5 toes upward, so dorsiflex those toes. And finally, the Fibularis Terseus, which is right here. Notice it's attached to the anterior fibula and only goes to the base of the 5th metatarsal. All right, so it's only going to go down as far as this. And so it will be involved in, since it's more lateral based, dorsiflexion of the foot at the ankle joint. So, moving our entire foot up at the ankle joint, and eversion of the foot at the ankle joint. So it's going to cause our foot to move outward. All right, and again, like we've talked about, it's innervated by the deep fibular nerve. This is another one of those muscles, like the plantaris, which may be absent in some people. And of course, we already mentioned that the anterior compartment muscles are innervated by the the deep fibular nerve, all right, which is a branch of the common fibular nerve. The superficial branch would innervate the lateral compartment. The deep branch would innervate the anterior compartment. And then the blood supply would come from the anterior tibial artery running along with the deep fibular nerve and supply blood to all of the anterior compartment muscles.